Hello everyone, Dr. Sean Reyes, Las Vegas podiatrist, dressed up nice like a little sophisticated grease monkey here for you today because today we have double trouble. Double trouble? Double trouble. Double trouble? Double trouble. What do I mean by that? We have two toenails, both on the gray toenails that are fungal infected toenails that are causing the lady pain at times, and they're starting to dig into the corner, so I'm going to remove them. In the process of removing them, I am going to burn the root with acid. Acid! No, not that kind of acid. Phenol. I'm going to go along with Q-tips along the base so the nail never grows back. And by never, 70 to 80% chance it doesn't come back. Wonderful procedure. Now, the question is, does removing the toenails cure the fungus so it never grows back? Let's say I didn't want to do the acid, just remove them. Will the nail grow in clear again? No, it's not a cure. If a cure was removing the toenails, I'd be doing it on everyone. Now, one thing it can do is once the new nail starts growing in, you can hit it with an antifungal cream, laser therapy, pill, antifungal Lamisil pills to help decrease the chances of the fungus coming back or making it grow in worse. But simply removing it is not the cure. But some people would rather have no nail than this big, thick, ugly toenail. So let's remove it. Let's get started.
Dr. Reyes, Dr. Reyes. Dr. Reyes, Dr. Reyes, Dr. Reyes. Dr. Reyes, Dr. Reyes, Dr. Reyes. Dr. Reyes, Dr. Reyes.
All right, I'm using betadine here to prep the area. Betadine is an antiseptic, and you want to reduce the bacteria as much as possible. You know, this isn't a sterile procedure. It's a clean procedure, and you want it as clean as possible. Typically use betadine or chlorhexidine with any surgery, really. If you're having open heart surgery, this is what they're prepping you with. And that is not a cock ring, that is a toe tourniquet. I use it to decrease the blood flow. Now, if I was just removing the toenail, I typically don't need the tourniquet. It's not that bad of a bloody mess, but when I'm using the acid, I want it as dry as possible, and I don't want the blood gushing down and flushing out the acid and whatnot, so I'm putting that tourniquet on there. I'm using a little freer here. I'm going to free the area, just the skin, and separate it from the nail, and then I'll be going in with hemostats in a minute. Just gently push that in there and separate the tissue from the nail. Now you can go in the front way or you can go in the back way. I'm going in the back way here, doing a reverse bottle cap removal of this toenail. So I'll get the hemostats, go in the back door here, spread the stats, take off the nail. Spread it, and you can just see it coming out nicely already. Yeah, come on. Yeah. That was firmly adhered down there. You can tell she had some sort of trauma here. That nail bed isn't as smooth as it should be. Looks a little lumpy, grumpy with some lines in it. That should be pretty flat. So the nail is having difficulty growing, difficulty biting, and adhering down to that certain areas of the nail bed. Now I'm just removing some of the remnants of the nail, some of the dead tissue. With some hemostats here, I'm going to go in there and do a sweep and clean out all that. Just doing a sweep around the area, making sure there's no remnants of nail or any buildup of tissue. If I go in there with the Q-tips and try to burn the root there and there's little pieces, it'll interfere with it. What I'm doing next is I'm getting 4x4, just a little gauze, and I'm drying the area out. Again, I think that is very important when you're doing this procedure. If it's very wet around the area and it's bloody, it's just going to dilute the acid and won't be as effective. It's a little tidbit. A lot of docs don't do that. They just put the Q-tips in there. It's good to dry it out. Sometimes I dry it out in between each Q-tip, each time I go in with the acid. Next, I dipped these Q-tips in phenol. That is my acid of choice. and I'm going to go and rub it along that base where the matrix is. Now, the matrix is the structure at the bottom of the nail bed there, and it is responsible for the nail growing. If you go back to my first video and rewatch that, the worst ingrown ever removed, I get more in depth with exactly what the matrix is, and I show some pictures. But long story short, if you burn that, good chance the nail never grows back, and that's the goal here. There's a couple different ways you can do this. You can use the phenol like I'm doing now. I go 3 different occasions for 30 seconds, and then I just repeat it 3 more times here, or 2 more times for a total of 3 times. But you can also use sodium hydroxide. That's another acid that's used. Now, a more difficult way that you can do this is to physically remove that matrix. Get a 15 blade and go in there and physically remove it. And that's something you want to do in the operating room because you get down to bone when you're doing that. But this is easier, and it's more effective in my opinion. It's not as steep of a learning curve either. Now, when you're doing these Q-tips, think of it like if we were just doing the corner, it's relatively easier and a little bit more successful. And what I mean by that is it's a small area and the Q-tip and the acid is as concentrated and isolated that corner. When you're doing the entire base, there's more surface area. So you see me going back and forth like a windshield wiper, trying to get that entire base and trying to evenly get it all along the base. Here we go, 3 of 3. Get those corners, get the center. You want to get all around that base. All right, and we're done. What I'm going to do now is get some alcohol, some isopropyl alcohol, and flush this out. That'll neutralize the acid. I do go pretty overboard with this, but I want to make sure that that is out. So I just spray, spray, spray. Take the tourniquet off, and then I go back and spray some more. Just making sure all that acid's out. The procedure's done. That's it. That's simple. Told you the removal's easy. All right, I got a little antibiotic ointment there. I put it on a non-stick pad, and then I'm gonna put some 4x4s and a Coban. I'm gonna have the patient soak the foot tomorrow with the bandage on because it comes off easier. If you don't put that non-stick padding on there, it just sticks, the gauze can stick to the area and it's already sensitive and it can be difficult to remove and painful. So I like to use that non-stick pad, and I like to have the patient soak the next day with their foot with the bandage on. That way it comes off much easier. Yeah, all done there. And again, you don't want to put that the Coban on too tight. It's not forgiving. So I put it on snug, but not too tight. There we go. Go move on to the other foot here. Now, I'm going to do the injection. I didn't show the injection on the first one. I probably had the camera, probably forgot to record it or whatnot. So if you want to see the injection, here it is. Get a little alcohol on there. Got lidocaine here. I'm just going to go in 2 injections on the side, and then I'm going to go across on the top of the toe. Now I don't typically do the bottom injection. I do 3 injections. I do the top, right here, what you're seeing, and then I do the 2 sides. In 95% of the cases, that's plenty. The bottom injection tends to hurt. I mean, it's not wrong to do the bottom, but I just find it hurts, and most people don't need it. Okay, we'll give the patient a little bit of time here, and I'll come back and do the removal. All right, and we're back here. It's probably 5-10 minutes. Patient's nice and numb. I'm gonna do the same thing I did last time. I'm gonna get that freer, go in there, loosen that tissue from the nail, get it nice and ready for the hemostats to come in. Gonna go in, doing a reverse bottle cap here. We'll spread the hemostats and separate the nail from the nail bed. Yeah. There it is, coming off nicely. Nail bed looks like the other toenail. Go in there and clean it out, get that scar tissue, get that tissue build up out with the hemostats. Dry it off with the 4x4 and get ready for the phenol. And again, I'm going to repeat it just like I did on the other side, and I'm going to cut this video a little bit short here, and I'll do a couple more of the acids here, but you already saw the dressing on the other bandage, so we'll just finish up here and that'll be it. Finish up with the Q-tips, and I'll put the bandage on, and that's it, and flushing with alcohol. If you have any questions, feel free to drop a comment. Thanks for watching.
What's going on, everybody? I hope you enjoyed that video. If you did, please click the like and subscribe button with the bell notification so you're notified every time I upload a new video. I also have a martial arts channel that's pretty sweet. You can check out some of the videos here and follow me there as well. Anyway, thanks for watching.